Hi, welcome again to my channel. This is Ness Caroline. Today I'll be talking still on hypertension, but differently from my previous video. On the previous video, I did talk on things you can do to prevent high blood pressure, like exercise, eating healthy, and following up for your physicals with your doctor, checking your blood pressure. And today I'm still going to continue on that. What is high blood pressure? Hypertension. Hypertension is a condition in which the force of the blood against the artery walls is pumping too high in your heart. Usually, people with high blood pressure can go undiagnosed because why? In most people, it doesn't have symptoms. You don't feel nothing in most people. But with some people, they can complain of severe headaches, tension on the neck pain, and body pain, just, common things like that. You would not know that you are getting into hypertension condition if you don't check your high blood pressure or if you don't regularly visit with your doctor. So the goal is checking your blood pressure. You can check your blood pressure yourself in the house, and if you see your numbers going up, what are these numbers? A number that is considered like pre-hypertensive. If your blood pressure is going 135 over 90, please talk to your doctor. Maybe your doctor can start to give you things like prescribe you things like diet, referring you for a dietitian to see a dietitian, or controlling your salt intake, your fat intake, increasing your exercise at that level. But if your blood pressure is going up to 140 over 90, please see your doctor again, because at this point, most doctors, they will put you on medication. If the blood pressure is going up to more than 140, going up to 180, that is severe hypertension that you are already in, which can cause severe diseases. It can lead to heart diseases, can lead to stroke. So that's why it's very important to check your blood pressure and contact your doctor. Follow up with your doctor. Okay, now if your blood pressure has reached that number, you've tried everything, it's not being controlled. You went to your doctor and your doctor put you on medication. So I'm trying to break these things down in a lay way that even anyone that is not in the medical field can understand. I'm trying not to use terms that are for medical professionals, because some of these terms, I work in the hospital. When you use some of these words, the patients don't understand. So you have to say it in a way that everybody can understand, because not everybody knows all these terms. Not everybody went to school for nursing or to be a doctor or pharmacist or all of that. So I'm trying to make it in a way that everybody will understand. But these numbers, to take your blood pressure, you get a blood pressure cuff, you put it on your hand, you run it, you see the numbers, let your doctor know. If you're having headaches, you're having tension on your neck, let your doctor know. Now, what happens if your doctor have put you on medication? If your doctor have put you on this medication, high blood pressure medication, any of them, there are many of them, your doctor will explain to you what type he's giving to you. Once your doctor explains to you what type of medication they're giving to you and they put you on it, make sure you take that medication the way the doctor asks you to take it. Take your medication daily according to how your doctor asks you to take it faithfully. Don't fail. If you're taking this medication and you think that it's making you sick or it's giving you some side effects, call your doctor. Don't just stop it abruptly. Don't stop your medication like that. Talk to your doctor first and see what your doctor suggests for you, or what your doctor would do, without changing the medication, or the doctor will call you in, assess you, and see what is going on. But it's not advisable to just stop your medication at home, like, oh, this medicine makes me sick. Or maybe somebody have told you that you can use this, use ginger, use garlic, you mix all these herbs, it will help with high blood pressure. For me as a nurse, I will advise everyone that no, it doesn't work. Stay on the medication that the doctor has prescribed for you. and follow up with your doctor to prevent your blood pressure going too high. When your blood pressure goes too high, it causes more heart diseases. It can at a point get your heart to big, which they call it cardiomegaly, which means enlarged heart. That means your heart is getting bigger, and that means your heart is getting tired from the force of that blood every day hitting into your heart. Your heart get bigger and bigger, and what happened when your heart get bigger? It doesn't pump the blood out of it as it's supposed to pump that blood out into your system. It doesn't pump like that. Like your heart, your heart goes like this, so strong. But when your heart enlarge, it just feeble. What happened? It feebles like this, the blood only goes out a little bit and some remaining inside your heart. And now your heart is full of fluid. And what happened? That fluid now will back up into your lungs, and your lungs too start having fluid. What happened? Now you start having problem breathing. Okay, now your heart is failing. Now you can get stroke. Some people get stroke before that stage. Some people can get stroke after this stage. So please, if the doctor gave you blood pressure medication, diagnose you that you are hypertensive and put you on blood pressure, make sure you take it every day, because blood pressure at a certain level that is uncontrolled causes a lot of problem to your body. Your heart will fail eventually, including your lungs. Your lungs and your heart are like twin sisters and twin brothers. They work together. If one is not doing well, the other one is not doing well. And by so doing, if your blood pressure goes uncontrolled, then it can affect your kidneys. Because guess what? Your blood is filtered in your kidney. It affects your kidney working too hard, and what happens? Your kidney starts to fail. When your kidneys start to fail, what happens? You're looking at dialysis. So you see that the consequences is even more than that pill, popping that pill and putting it in your mouth every day. So this is the lesson for today. Since I mentioned the word stroke, the next video we'll be talking on stroke. What is stroke? How did it happen? How does it happen? And how can you notice that somebody is having a stroke? If you look at somebody, how can you know that this person, no, I think this person is having a stroke? And what do you do? So on our next video, we'll be talking on that. So like and subscribe for more video, okay? I try to break it down for all of us to understand. Thank you.